Just go up to the gate. Just come back. You are walking so slowly.
Okay.
Is this your normal walk?
No, I am walking generally because doctor.
Once again, another round. Walk normally. Limping coming. Yes. Once again. Limping is coming. If you walk in the speed,
Yeah.
then limping comes.
Yes, if I'm walking speedily, then I'm getting pain.
Yes. Stop. What is your name?
My name is Prashant Kumar.
From where?
I came from Hyderabad.
From Hyderabad. Okay. So where is the pain right now?
I have pain in the lower part of the left hip.
Okay. Left hip. You are
Yeah.
feeling pain right now. Okay. Back side of the hip. Is there any pain?
Yeah, I have pain here in the.
You have pain here also.
Yes, sir.
Okay. Is there any pain in the knee joint also?
Yeah, I'm getting on the left.
Left knee joint also. Okay. Lift your leg like this. Now you are feeling pain.
Now I'm feeling pain.
Okay. Now lift your another leg. Feeling
No.
pain?
No pain,
No pain
on the
there?
right. No pain on the right.
But feeling pain here also?
Yes.
While putting your leg, this right leg upside, you are feeling pain on the left side also. You are able to put your weight on this. Just
Yeah.
check it. Yes. Now feel
Little bit
little
of
bit pain. That means there is a difficulty in taking the weight of your body on the another leg. Okay. Now open your leg like this. Open your leg like this. How much open you can? Yes. Any pain?
No, right now.
Some more.
Now
No.
I can feel the pain.
Now you can feel the pain. Okay. So in MRI, it is showing second. Okay. Is there any pain in the night while sleeping position or changing?
Yes, when I tilt a little bit on the left side or right side, if I move like this, I sense the pain.
Then
on
you
the
feel
left
the
side.
pain.
Yes.
Okay. Do you feel the pain while sitting in the chair also?
Yeah, if there is a sudden reflex action, just if I move, I'm like this or put left like this,
Okay.
then I get the pain.
You cannot even put your leg like this and then open. Try to do this. This and open.
Now I'm feeling the pain here.
Feeling the pain, huh? Okay. So you are following my exercises or not?
Not yet. I haven't started it.
You haven't started. Okay.
I want to visit once and
Okay. So let's see what are the changes after the 7 days. Yes, very good. In normal walk.
Okay.
Yes, come back. Yes. So, Prashant ji,
yes, sir.
how are you feeling after this session?
I'm feeling very good. My pain is totally relieved from the left side.
Okay.
Yeah.
What about the range of motion? Just show me your movement. Very good. Open your legs. Very good. Okay. Everything is fine. No pain?
No pain at all.
Okay.
I used to have knee pain, but that is also totally gone.
Okay, knee pain is totally gone. Okay. There is no back pain?
I used to have, but now no back.
No back pain.
I can bend now.
You can bend.
Little bit of itching there, but
Okay. And what about the pain in the night?
no, sir, not. I'm
You
not
can
getting
you can change your position.
Yes,
No
I
problem.
can
You
change
can
it.
sit in the chair also.
Yes.
For long
I'm able to
duration?
sit, yeah.
अरे वाह,
Long
very good.
time.
Treatment कैसा लगा फिर?
Treatment was very good, sir.
Very good.
Before coming, I felt like how it gonna be because this is my first time coming out of Hyderabad. But treatment was very nice.
Okay.
The staff and everybody is very nice, and even you arranged our stay and even the food.
Yes.
So that was so much helpful.
So happy with the treatment?
Absolutely happy there. Totally.
Okay. Hello friends and welcome to all of you. Myself Dr. Vijay Prakash from Saubhagya Ayurveda, Haridwar, Kanpur, senior resident doctor at Saubhagya Ayurveda, specialist in AVN and spine and joint related. फ्रेंड्स AVN की सीरीज में एक पेशेंट और हैं जो कि हमारे पास तेलंगाना से आए थे एंड योर नेम इज मिस्टर प्रशांत.
Prashant Kumar, sir.
प्रशांत कुमार. तो फर्स्ट ऑफ ऑल हम लोग प्रशांत जी को नमस्कार करें. नमस्कार प्रशांत जी. इनको AVN की समस्या थी और सबसे अच्छी बात है कि ये हमारे एक पुराने पेशेंट्स के थ्रू रिकमेंड हो गए थे. जब उनको बिलीफ मिला और रिलीफ मिला साथ था, बिलीफ एंड रिलीफ बोथ,
Yeah, absolutely.
उसके बाद ही आए. तो यस प्रशांत जी, यू कैन स्टार्ट फ्रॉम द बिगनिंग. आप कैसे आए, कैसे पहले सबसे पहले तो AVN पता कैसे चला आपको from the starting?
So from 5 months, I was having pain in my left hip.
Okay.
So whenever I do extra activity like playing cricket or climbing too much of stairs, I used to get the pain. But I thought it was normally light.
Okay.
I went to an orthopedic doctors in our Hyderabad. They did X-ray and they told that it is just a muscle cramp. They gave me device of medicine.
Okay.
After taking the medicine, the pain was subside for few days. But later, whenever I do stressful activity, I was getting pain. Then one doctor advised me to take a MRI. So I went and took an MRI, and then I was diagnosed with AVN stage 2 in both left hip and right hip.
Okay.
And I went to top hospitals in Hyderabad, but all of them just recommended to get core decompression with beam. But the only problem there was they were not giving any guarantee, and they were just telling that it is temporary. So I was in a dilemma whether to go for that or is there any other cure. Then one of my friend, Mr. Prabhandhan Reddy, he got AVN last 3.5 years back, and he somehow came to know Dr. Vijay Prakash sir, and
He had taken treatment near about 3 years back.
3 years back, sir. So he got the treatment from you, and he was totally recovered. So I called him and I spoke to him a couple of times, and he gave me confidence to come and visit. First of all, I thought like Kanpur is very far. Maybe I can come to Pune or nearby
Other
branches,
places.
Warangal branches, camps. But then he recommended me like come there. There will be a 7-day stay. It will be nice, and there are additional procedures. So I came to Kanpur, met you, sir. You treated me very nicely. Again, I have to thank all the staff here. They were very polite and they're very caring. You know, even if you ask many things, no, they come and do. They don't hesitate. Gussa nahi aata hai, itna bar karwa hai. This is very good. And even the food wise also, we were thinking because south and north ka thoda problem, food ka change hai. But sir arranged a catering service here. The food was very good. The good thing is for the treatment, so you don't have to worry about that. It is all fine. Yeah, somewhat initially one day you may feel differently, but this is Ayurveda, and personally I can say that this gives you more comfort, and this is can go more confidence from this, because it's not only about the treatment, but sir will suggest you the diet, exercises, those are must. So in allopathy, what I felt is like they do just the surgery and it's again back to normal. So if you continue the same way, I don't know how the problem will be treated. But here sir has suggested us some beautiful exercises which we have to do compulsorily on a daily basis. Then diet also we have to follow to avoid certain pain, and regularly consult with sir to change any medicine on change our any positions if needed. So by doing that, I got very confident that I can definitely come out of this AVN problem. So initially I was thinking there was not cure, but after meeting Dr. Vijay Prakash sir, I felt more confident now. And you can see in my previous video also how I am able to move my legs and comfortably act. Yeah.
Initially, there was a problem in
There
walking.
was a lot of problems, so yeah, I could not sit.
So, what do you recommend to the other AVN patients, especially youngsters, especially for the youngsters?
Yes, absolutely. So there are so many treatments outside available, but what I personally feel is that you first try Dr. Vijay Prakash. This is the best in India, is what I feel so far. So you try this, you will get more comfort, then you can decide. But once you come here, no, I don't think you'll have any other option, because you will be cured. So come and visit Dr. Vijay Prakash sir in Kanpur.
Yeah.
If possible, come to Kanpur. Otherwise, you can meet in the different camps.
In the different
I definitely recommend everyone to come and visit sir and get an idea of these things.
Do you want to say something to patients, especially in Telugu language?
Absolutely. అందరికీ నమస్కారం. నా పేరు ప్రశాంత్. నేను గత 5 నెలల నుంచి AVN ప్రాబ్లంతో ఇబ్బంది పడుతున్నాను. MRIలో చూస్తే నాకు స్టేజ్ 2 అని డాక్టర్స్ తెలిపారు. హైదరాబాద్లో ఉన్న టాప్ హాస్పిటల్స్ అన్నీ నేను తిరిగాను. అక్కడ వాళ్ళు నాకు చిన్న సర్జరీ, కోర్ డికంప్రెషన్ విత్ డీమ్యాక్ చేయాలని సజెస్ట్ చేశారు. కానీ నాకెందుకో ఇంత చిన్న వయసులో సర్జరీ కాకుండా ఇంకా వేరే మెథడ్స్ ఉన్నాయి, వేరే ట్రీట్మెంట్స్ ఉన్నాయని నేను కనుక్కుంటున్నప్పుడు ఒక ఫ్రెండ్ ద్వారా నాకు సార్ డాక్టర్ విజయ్ ప్రకాష్ సార్ తెలిసారు. తనతో నేను ఫోన్లో మాట్లాడాను. తనకు నా MRI రిపోర్ట్స్ పంపించినప్పుడు తను నాకు చాలా ధైర్యం ఇచ్చారు. తన ఓల్డ్ వీడియోస్ యూట్యూబ్లో చూశాను. తన ఎక్సర్సైజ్, తన చెప్పే విధానం నాకు ఎంతగానో నచ్చి నేను అల్లోపతి డాక్టర్స్ చెప్పిన సర్జరీ కాకుండా డాక్టర్ విజయ్ ప్రకాష్ సార్ది థెరపీ కోసం వచ్చాను. కాన్పూర్కి సండే 15వ తారీఖు సండే ఆఫ్టర్నూన్ వచ్చాను. ఈరోజు మళ్ళీ సండే 7 దినములు నేను 14 సెషన్స్ తీసుకున్నాను. మొదటి రోజున నేను ఏ విధంగా వచ్చానో నొప్పితో వచ్చానో, ఇప్పుడైతే ఆ నొప్పి అనేది లేదు. నేను నా లెగ్ మూమెంట్స్ కానీ, సిట్టింగ్ పొజిషన్ కానీ, వీపు నొప్పి కానీ ఇవన్నీ కంప్లీట్గా నార్మల్ అయిపోయింది. నేను ఏవిఎన్తో బాధపడే పేషెంట్స్కి ఒక సలహా ఇస్తున్నాను. మీరైతే ఫస్ట్ డాక్టర్ విజయ్ ప్రకాష్ సార్కి ఫోన్ చేసి మీ ఎంఆర్ఐ రిపోర్ట్స్ కానీ, ఎక్స్రే రిపోర్ట్స్ కానీ ఒకసారి పంపించండి. సార్ వాటిని చూసి మీకు సజెస్ట్ చేస్తాను. మీరు కంపల్సరీ కుదిరినప్పుడు సార్ క్యాంప్ కానీ, కాన్పూర్ కానీ వచ్చి ఇక్కడ ట్రీట్మెంట్ ఒకసారి తీసుకోండి. తర్వాత మీరే చూస్తారు, మీ ఎక్స్పీరియన్స్తో మీరు చెప్పగలుగుతారు మీరు ఎంత రిలీఫ్ వచ్చిందో. అండ్ సెకండ్ వచ్చి కాన్ఫిడెన్స్. మనకి బయట డాక్టర్స్ ఓన్లీ మందులు వాడండి లేదా ఇంకేమైనా చెప్తారు, కానీ ఇక్కడ మాత్రం మనకు డైట్ కంట్రోల్ కానీ, ఎక్సర్సైజ్ కానీ, థెరపీ ఎలా చేసుకోవాలో మేము అడిగాము సార్ని 2-3 పద్ధతులు. వాళ్ళు చేసే ప్రొసీజర్స్ మాకు ఎక్కడంటే పోట్లీ అది ఎక్స్ప్లెయిన్ చేస్తారు. తర్వాత ఇంకొకటి, సో సార్ ఈస్ ఓకే టు టెల్ అండ్ రివీల్ ఆల్ హిస్ సీక్రెట్స్. యూ విల్ ఫీల్ మోర్ కంఫర్టబుల్ అండ్ ఈజ్ ఆల్వేస్ యాక్సెసిబుల్. చాలా ఎప్పుడు ఫోన్ చేసినా వాట్సాప్లో కానీ చాలా తొందరగా రిప్లై ఇస్తారు అండ్ మనల్ని అర్థం చేసుకుంటారు, పేషెంట్ ఫ్రెండ్లీ. కాబట్టి మీరు దయచేసి మీకు కుదిరినప్పుడు సార్కి కాల్ చేసి ఏవిఎన్ ట్రీట్మెంట్ తీసుకోండి, మీరు చాలా రిలీఫ్ అవుతారు. ఇది నా టెస్టిమనీ.
थैंक यू सो मच। एंड आप सभी लोग हमारे इस चैनल को जरूर सब्सक्राइब कर लीजिए और उन पेशेंट्स के साथ ज़रूर शेयर कीजिए जो बेचारे बहुत गरीब हैं या बहुत ज़्यादा पेन की कंडीशन में है और बेड रिडन कंडीशन में है, वॉशरूम तक जाने में भी जिनको बहुत प्रॉब्लम हो रही है, उनके साथ ज़रूर शेयर कीजिए ताकि वो लोग थोड़ा सा उनको हेल्प मिल सके और घर पे ही एटलीस्ट 50% तक तो वो कवर कर सकते हैं अगर कोई बहुत डिसिप्लिन के साथ अपना एक्सरसाइज फॉलो करते हैं, तो सब चीज़ें उन्हें आराम मिलेगा। तो ठीक है फ्रेंड्स, स्टे ट्यून्ड विद अस, टिल देन नमस्कार।